Good evening. I'm Christine Johnson.
I'm Maurice Dubois. On strike for 17 hours and counting, and thousands of nurses at two major city hospitals are not backing down.
One is Montefiore Medical Center in the Bronx, the other Mount Sinai in East Harlem. And tonight, we have learned that one of those hospitals is back at the negotiating table. CBS 2's Bauman live at Mount Sinai in East Harlem with the latest developments for us. Ali?
Christine and Maurice, the nurses say they will hold the line as long as it takes until there's a contract both the union and hospitals can agree to. We know Montefiore is going back to the bargaining table at 10 a.m., but talks have stalled here at Mount Sinai, which means tomorrow may bring a second day on the picket line. The sounds of pots and pans clanking were once a thank you to healthcare workers. Now, 2 years later, it's the sound of nurses on strike.
This is just about a show of nurse power throughout the entire city.
7,000 nurses walked off the job at Montefiore Medical Center in the Bronx and Mount Sinai Hospital in East Harlem Monday without a contract.
When we didn't know what the hell was going on with COVID, they were in there, risking themselves, risking their families. And now you have to make them stand in the street for a contract in the cold?
Both hospitals offered a 19% pay raise over 3 years, but the union maintains its priority is staffing.
You have 500 vacancies, you got to hire them. It's not like a promise you can make at the bargaining table, you just need to hire them.
The nurses say being so understaffed is unsustainable and unsafe.
We have ER nurses with 21 patients, 21. You can't even walk in the department.
When you deal with a lot of patients, you're prone to making mistakes.
Mount Sinai blames the vacancies on a workforce shortage and claims they've hired 4,000 nurses in the last 3 years.
We had submitted to them a very robust staffing enforcement proposal, and we were waiting to get a counter on that, and we did not receive it at the time that they left negotiations.
Nurse Julia Quantz avoided a strike at her own hospital, New York Presbyterian, but came to support her Mount Sinai sisters.
We're all ready to hold them accountable for the way that they give the money to the CEOs, but not to the people who are keeping the patients safe.
Every union member in this city should be supporting these nurses.
In the meantime, hospitals have brought in traveling nurses, are diverting ambulances, and referring patients to other facilities.
I'm ready to be here until we have a contract.
The state has also sent surveyors to make sure the hospitals are operating safely during the strike. And it is important to note that both the hospitals and the union want to make it clear that people should not delay getting medical care during the strike. After all, we are in a tridemic. We're live in East Harlem. Ali Bauman, CBS 2 News.
Okay, Ali, thank you.